All right, so today we're going to be talking about how to keep your bones and muscles strong as you age. As I've introduced myself earlier, for those of you who had the pleasure of meeting for the first time, I'm a consultant orthopedic surgeon working from the Sengkang General Hospital cluster. I'm also a member of the Active Aging Committee in Taman, Jurong. I have had the pleasure of growing up in Taman, Jurong, and my parents and a lot of my family still stays there, and it's really a place that I've grown to be fond of. I also wear another hat in the Duke NUS Medical School as an assistant professor, doing really research in musculoskeletal conditions to do with the joints and bones. So today, I've had the privilege of having Mr. Gareth Chu, who is a principal musculoskeletal therapist and also the director of Heartland Rehab Center, which is really a physiotherapy outfit. And he has a special interest in treating clients with low back and neck issues. And he will be sharing on how exercise can help you later on in the talk. So today I'm going to be giving you an introduction to concepts of bone and muscle health. And Gareth is going to be addressing on exercises to maintain bone and muscle health. This is a very interesting topic because we are really talking about aging, right? And aging is something very philosophical, is something very close to our heart. And of course, we don't stop thinking about this, right? And some of these things that happen to our bones and muscles are sometimes unavoidable as we age. But is there no other choice? Do we have to run into problems with our strength in our bone and muscle? Not really. There are things we can do to equip ourselves with the knowledge to try to prevent the progression of what we call aging-related problems. And that's what we are here for today, for me to share with you guys on what are some of these concepts and what we can do to halt or slow down the progression of some of these problems. Now, the first thing I'm going to talk about is osteoporosis. Osteoporosis is the medical term, all right? And it really just means hollow bone, right? If you loosely translate the word osteo and porosis, osteo refers to bone, porosis refers to what we call a porous material, which means it has multiple holes in it and allows things to pass through, means it's weak. So medically speaking, osteoporosis is a progressive, now the key word is progressive, bone disease that weakens the bone, and not just weakens the bone, it increases the risk of you suffering from a fracture, especially if you fall. Now, why is it important for us to know about osteoporosis or to intervene and do things to prevent it? It's because it is silent. It is a silent disease that happens in the background, and you don't know that you have it until something bad like a fracture happens. So before that happens, we want to be able to screen for the osteoporosis, identify those who are at a higher risk of osteoporosis, and perhaps start preventive treatment or actual treatment for osteoporosis early. So that's why we're talking about osteoporosis. If I show you a picture, right? Now, on the left, what I have here is healthy bone. And as we age, this is what happens to our bone. It becomes from a very dense, thick, healthy bone to a very thin, spongy bone with lots of holes in it. Can you appreciate this? You can see that there's a lot more holes and what we call porosity. That's why the disease is called osteoporosis. So imagine if a young 20-year-old boy, is cycling and falls, nothing much is going to happen to his bone because they are strong and they are able to take the weight of his fall. As opposed to someone who is in his 75, right, has already undergone or rather has already menopause, for example, right, and their bones are weakened. Even a small fall from a standing height can cause catastrophic outcomes such as a hip fracture or a spinal fracture. So why is this important for you? What does it mean to you? That's what we're looking at today. So this is a very simple chart, right? We can look at the curve for males and females. So as you see, in your younger ages, as you are going towards your middle age, your bone mineral density or your bone mass, the amount of calcium in your bone or the amount of real estate, so to speak, in your bone increases at a very steady rate. It reaches a peak at about 30 for both male and female. And you can see that because males tend to have more muscle per kilogram of body weight, they also tend to have a greater bone mass per body weight at all stages of life. But even for males, after the age of 50, right, the bone mass decreases. But In the females, the loss of bone mass is slightly earlier and happens at a faster rate from the age of 40 to 60. And that corresponds with menopause. And that is largely due with the protective effect of estrogen, which is one of the hormones that we have in our ladies that protects your bone and helps the bone absorb and use calcium better. Now, that's the reason why osteoporosis happens at an earlier age for ladies, right? Now, let's move on. So what does this mean for you? Now, as I mentioned, osteoporosis is a silent disease. You may have seen many people in our community, or as you walked about, people who are walking with a hunched back. And that is largely because the bone in their skeleton tends to collapse with time. Now, this is because of osteoporotic fractures that happens in the bone without giving much symptoms. It just so happens. And therefore, they tend to have collapse of their spine and they're unable to maintain an upright and straight posture. And they walk with a hunchback. This is what it means to you. If you are someone with a similar posture, you very well could have had osteoporosis for years without even realizing it. What else does osteoporosis cause? Now, as I mentioned, one of the feared complications for osteoporosis is fracture. Now, what are the bones that are most prone to fracturing when you have osteoporosis? As I mentioned just in the slide before, the spine is one of these places where the fractures can happen very commonly. Other very common injuries happen in the wrist, especially when you fall and you use your wrist to break your fall, right? That's the first thing that fractures. The next thing is the hip. When you fall and you land on your buttocks, your hip bones tend to be a weaker area in your lower limb and they tend to fracture. And hip fractures are a very bad injury to have because they often require surgery to fix. And even after fixing, your walking ability may not be as good as before. And when you are lying down because you are too sick to undergo surgery, you tend to lose a lot of muscle. You tend to get chest infection and you can get urine infection. And all of these can be actually life-threatening if they are serious enough. Thankfully, shoulder fractures, when they happen, can often be treated without surgery and you're still able to walk even though you have a shoulder fracture. So it's not a very serious injury to have, but it's one of the bones that can be fractured in an osteoporotic patient. Now, what are the risk factors for osteoporosis? Are you at risk? So this is what you would be most interested in finding. I earlier already mentioned that women, especially postmenopausal women, because of the loss of protection that is given by estrogen, which is a hormone that we have, you do have a higher risk of osteoporosis. Now, men with smoking, what does smoking do? Now, smoking reduces the blood supply to your bones. So excessive smoking is going to make your bones weak as well. And not just that, what else smoking does is it reduces calcium absorption by the bone and therefore weakens the bone once again. We can't run away from genetics. If you have a very strong family history, if your parents have osteoporosis, there is a higher chance that you might get osteoporosis as well. And of course, having an inactive lifestyle, when you do not do enough exercises, your muscle mass reduces and your bones are put through less stress. Now, bone is a very interesting material. You need some amount of stress to go through the bone for the bone to actually strengthen itself. Therefore, if you're not doing any physical activity, your bones tend to weaken just like that, right? And that contributes to osteoporosis. Next, like I said, we can't stop aging. So this is one of the non-modifiable factors. None of us can do anything about aging. And just simply the fact that we are all aging puts us at risk for developing osteoporosis. In men, in some men, you may have a medical problem or a condition that reduces your testosterone levels, similar to how estrogen protects ladies, testosterone protects men as well because it increases the strength of bone. And having low levels of testosterone can, of course, give rise to poorer or lower bone density and therefore osteoporosis. Excessive alcohol intake. Alcohol increases this hormone in the body called cortisol, right? It is basically, if you take too much steroids, if you have a medical condition that you take a lot of steroids for, you can also have an increase in this hormone or chemical in the body called cortisol. Now, what does cortisol do? It increases resorption of bone. What is resorption? Resorption is a natural process whereby bone renews itself. right? The body recycles old bone and produces new bone, but it is a fine balance. If any one time, if you have increased resorption of the bone is just washed away more than it is being replaced, then obviously you're going to have weakened bone. So that's what alcohol does. And smoking, I've already spoken about earlier. What are the other risk factors? If you're someone extremely thin, your BMI is less than 18, or you're very small frame, because of the fact that you have reduced bone mass, you don't have enough real estate to begin with, therefore you're at higher risk of osteoporosis. And obviously, if you do not take enough calcium and vitamin D as well, vitamin D is very important, especially the active form of vitamin D for bone to actually absorb the calcium. Even if you take enough calcium, but you do not have enough vitamin D, the calcium cannot be used by the bone. So it's important to take vitamin D. Walking in the morning sun obviously activates the vitamin D in the body, but you need to eat enough good green leafy vegetables to get enough stores of vitamin in your body. Otherwise, you might need supplements and injections. I've talked about steroids and anti-seizure medications. Both increase cortisol levels in your body and therefore increase the turning over of bone. And at this time, I would like to address JC's question about application of topical steroids, creams, right? So creams or steroid creams as you apply on your skin do not get absorbed by the bloodstream as much as something that you take orally. So do not worry. If you have been prescribed a steroid cream for rashes, long-term use of it hasn't shown to actually cause osteoporosis, although it can cause thinning of your skin, right? It can cause a skin problem rather than a systemic problem like osteoporosis. And some people have chronic medical conditions like kidney failure. If you have any form of kidney failure, it itself can cause a reduction in vitamin D and calcium in the body and also weaken your bones. Steroid sprays into the nose, again, the systemic absorption of those steroids that you spray into your nose is not as high as taking orally, so I wouldn't be too worried about it. Caffeine intake, does it affect bone? It's a good question. There's no strong evidence that regular caffeine intake would affect osteoporosis. But if you take a lot of caffeine, you tend to be what we call catabolic. You tend to lose weight, right? So if you take too much caffeine, it can cause some levels of burning out of your bone tissue and muscle tissue, but it has to be at extreme high level. So I wouldn't be too worried about it. I will address some of the other questions as we go along. Very interesting questions in the chat group, but we'll go through some of it will be answered when I cover some of my slides. Now, this will be very interesting for you. What is your risk, right? All of you might be wondering, I've talked about all these risk factors, but what is your risk? There's a very useful tool here. You can see a QR code on my slide. Go ahead, get your phone and scan this QR code. Otherwise, there is the URL that I've put there. And I'm happy to share this with you later on in the chat group as well. And this questionnaire is designed with the population in mind. That means this is particularly for Singapore's population. If you key in your details here, as I've done so myself, you can see my name there, my age, nothing really personal information, not to worry. It's just my date of birth and all my height, my weight, and all those other histories. It gives you a value. And this value is the percentage risk of you getting an osteoporotic fracture in the next 10 years. Now, if your risk is more than 5%, that is quite serious, which means you are at a high risk of getting a fracture, and most certainly you might actually have osteoporosis, and therefore you need to go for formal screening. So all of you can try this, today to see what your risk factor is for getting an osteoporotic fracture. It's called a FRAC score, and it is a very useful questionnaire that predicts your 10-year chance of having a fracture. It is, of course, more accurate if you have your actual BMD reading. If you don't have it, that's fine. You leave it blank, it will still give you a value. Now, how can you find out if you have osteoporosis? Now, osteoporosis, official screening is done via what we call a DXA scan, dual X-ray absorptiometry. And what does this entail is you have to go to a medical facility and they will use this machine, a double X-ray machine, to shoot X-rays at two regions in your body, the hip and the spine. The main reason is because these are two locations where osteoporosis affects the most. So it is most accurate to predict what is the bone density in these two areas. And what do they do with the values that they calculate, right? You are being compared to everyone your age in the population, and you are given a score. How far are you away from the average Singaporean your age? And they compare your bone mineral density to the average, and they tell you how far you are. So next slide will tell you the scale. So this scale tells you if you are 0, you are bang onto the average. Anything more than -2 means you have a normal bone mineral density. Anything from -2.5, sorry, anything more than -1. Anything from -2.5 to -1 means you have early disease, you have low bone density, but not low enough to be diagnosed as osteoporosis. But the warning signs are already there. You probably should take some calcium supplements, some vitamin D supplements, and do exercises to increase your bone mass to prevent it from slipping into osteoporosis. If your reading is -2.5 and below, that means you are -2.5 standard deviations. That's what we call in statistics, -2.5 segments away from what the normal population has. Then you are officially diagnosed to have osteoporosis, and therefore you will need some form of treatment, right? So that's what it means. So treatment for osteoporosis involves taking calcium and vitamin D supplementation. And the daily recommended unit, right, for vitamin D is about 600 units to about 1,200 units a day. You know, obviously, if you already have a deficiency in vitamin D, a blood test shows that you are deficient, you need to supplement even more. But average adult, if you are a healthy adult, you need at least the daily recommended unit of 600 units or international units a day. Someone asked about vitamin K. Vitamin K hasn't been known to really be involved with osteoporosis, but it is important for blood clotting. And yes, it produces healthy bone tissue as well. Not as important as vitamin D, but definitely, you know, lack of vitamin K has its own symptoms like easy bruising. You know, you have bleeding from the gums and all that. You might even get bleeding from you know, your urine. And therefore, you do need to make sure that you do not have vitamin K deficiency. It is not very common that someone has vitamin K deficiency, but if you do go for screening and if you have any of these symptoms of bleeding and all that, you probably might want to take supplementation. We do not recommend you to just take vitamin K supplementation over the counter, because it does, like I said, can cause clotting if you take too much of vitamin K as well. So an average ballpark figure is that you would need 1 microgram of vitamin K for every kilogram of weight that you have. But talking too much about vitamin K is probably beyond the scope of my talk today, but that is some general information for you to do. Now, some questions about how to test on your own if you have osteoporosis. Now, you might have heard of screening in the community with ultrasound of the heel and all that. Those are good screening tools, but they're not as accurate as a DEXA scan. So what I would say is, if you suspect you might have osteoporosis based on a questionnaire, or you feel that you have some of the symptoms I've mentioned or some of the risk factors, you do need to get a referral from the polyclinic or a general practitioner to be referred to a tertiary hospital to undergo the bone mineral density scan. I would say if your first scan shows that it's normal, you can probably wait out 2 to 3 years before you do your next scan. If your first scan already shows your osteopenic or osteoporosis, your doctor will usually treat you with either calcium supplements or actual medication for osteoporosis, and you would then be checked maybe a year or 2 later to see whether your medication is actually working. All right, so that's usually the frequency. Too much calcium is also not good. Someone is asking, someone with high blood calcium, can you take calcium supplements? If you already have a medical condition that causes you to have high calcium or low calcium, for example, kidney disease, or some patients may have other metabolic problems that causes high or low calcium, you do have to be careful about taking too much calcium because it can cause urinary stones and that can cause its own problem. So like I said, most of this is best to be guided by a medical practitioner who is aware of your other medical conditions. If you are generally have other medical conditions and you're not having a clean slate of health. Taking vitamin D without calcium is pretty rare unless your body's calcium levels are found to be normal and you have specifically a vitamin D deficiency. Then yes, you would be prescribed with vitamin D without calcium itself. And that usually tends to happen when you're a little bit older, because vitamin D levels can also affect your muscle strength, as we'll talk about later. So how do we prevent osteoporosis? Prevention is always better than cure. So Gareth will be talking later about some of the exercises you need to do. But of course, having an active lifestyle like walking or jogging regularly puts weight through your bones and strengthens the bones. Eating dairy products, dark leafy vegetables increases the calcium and the vitamin D levels in your blood. As I mentioned, alcohol and smoking are things that causes reduced calcium absorption, and limiting it, of course, with smoking, it has other health benefits if you stop it completely. And if you have found to be a deficiency in calcium and vitamin D, taking supplementation is always useful, but with a medical practitioner's input, as I mentioned earlier. I'm going to shift topics now. We would take questions at the end, and I would address some of the questions in the chat later on at the end of the talk, so we can give Gareth a good 20-25 minutes to cover his subject as well. But I'm going to quickly shift gears to muscle. We cannot ignore the muscles. Muscles, after all, are attached to the bones that we just spoke about. And as you age, you will find that I feel a little bit weak. I can't seem to do things as I used to before. And what is the reason? And now this topic of sarcopenia is gaining a lot of attention, not just in the community, but really in the hospitals. Again, just like osteoporosis, sarcopenia is a progressive degeneration of your muscle tissue. And it has such a significant effect on quality of life because a lot of people find that with their muscles not being able to function as they did before, you can't do the things that you love, right? Like going on walks, cycling, taking tracks, going out with your family. And therefore, it is very important. And it does not just affect your lifestyle, but if, let's say, you are going for some surgery, and this surgery might not be even related to muscle. You might be going for perhaps an appendix surgery or a surgery to take out something else that is growing in your body. Your recovery from that surgery, the healing of your wound, all that may actually be affected by sarcopenia and your muscle strength. And not only that, there is evidence to show that in patients with really bad sarcopenia, you might even have a shorter lifespan because people who tend to have weak muscles tend to fall. And when you fall, you may get life-threatening injuries from the fall. So let's talk a little bit about muscle and aging. So similar to bone density, you can see here that your muscles, again, peak at your adult life, right when you're in your 30s or 40s. Now, after that, you have loss of muscle. And the aim in your older stage of your life is to minimize the loss of muscle. If you don't do something to minimize your loss, you're going to go on a downward spiral of losing your muscle mass. And when you fall below a certain threshold, your performance is affected. And when you fall even below a certain threshold, you actually become physically disabled. And that is when you are wheelchair bound, you're unable to walk, and you're really homebound. Okay? So what does this mean for you again? So what does loss of muscle mass, what does it lead to? It gives rise to you even at rest. When you're sitting down, you need a lot of energy and you feel tired even sitting down because your muscles need a lot more energy expenditure even at resting. Now, that's not good, right? It also can mean that your body doesn't react to insulin as well as it should. And you might run into problems with insulin resistance or sensitivity, which is related to diabetes. Your muscle mass and your muscle strength reduces. You might find that your weight drops below a very critical level. It increases your risk of having physical disability. As I mentioned, it increases your risk of falls and definitely increases the risk of death due to being very frail. So someone who is frail compared to someone who's well-built has a higher risk of death when you go for surgery, for example. So if you do not watch your nutrition, if you do not eat enough protein in your diet and you tend to lose weight and lose muscle mass, you get sarcopenia. What does sarcopenia do? It decreases your strength and causes exhaustion. And what does that do? It gives rise to frailty, which then makes you want to fall more likely. And when you fall, you don't move. When you don't move, your muscle breaks down and you're stuck in this really bad vicious cycle. All right. And that is not good. So we need to break the vicious cycle somewhere. If you have risk of hormonal changes in your body, malnutrition, chronic diseases, and lifestyle factors such as smoking, alcoholism, and obesity, you are at a higher risk of getting sarcopenia. This is a questionnaire that you can easily answer to see what your risk is. It is not a diagnostic tool, but gives you an idea of what your risk is and therefore needing to be referred for further evaluation. You can just mentally do this. How much difficulty you have in lifting and carrying about 5 kilo weight. If you have no difficulty, your score is 0. If you're unable to, your score is 2. Similarly, do you need assistance in walking? How difficult is it for you to get up from a chair? How difficult is it for you to climb a flight of 10 stairs? And how many times have you fallen in the past year? Do a mental sum of this scoring for yourself. And if your score is more than or equal to 4, that means you need a more comprehensive evaluation. How can you find out if you have sarcopenia? Now, at the hospitals, we do what is called a hand grip strength assessment. We give you this tool and ask you to squeeze as hard as you can, and we see how hard you can press. That gives us a fair idea about your muscle strength. We time how fast you walk 20 meters. We can also do an ultrasound scan to see your muscle strength and the muscle mass and the cross-sectional area of your muscle. Now, I have to tell you that sarcopenia is a very new topic in hospitals even, and a lot of research is being done, and we have not rolled out anything concrete as we have for osteoporosis. So this is still an area that is constantly developing, and there's a lot of interest in. So if you are interested to find out more, ask your general practitioner, ask your polyclinic doctor for more information, and you can be referred to any of the hospital's research programs where they may be able to assess you for sarcopenia and put you on a high protein diet, for example, to see if you can benefit from it. Prevention and treatment for sarcopenia is extremely easy because all you need to do is maintain an active lifestyle to build up your muscle, or rather to prevent muscle from being lost, and eat a very healthy, nutritious meal, especially with the right amount of protein so that your muscle mass can be reduced. I've seen a lot of interesting questions in the chat, and I'm going to answer those, not to worry. Even if we don't have time to answer today, I'm going to ask Chun Seong to collate those questions for me, and we'll be answering it, and we'll make known these answers in a public platform for you to consume the answers at a later stage. But now I'm going to be passing on the mic to Gareth. Now, Gareth is going to be speaking about exercises to maintain bone and muscle health. And after 20-25 minutes, we'll leave about 10 to 15 minutes to address some of the questions that have already been asked on the chat, as well as take live questions from the crowd. Thank you. Over to you, Gareth.
Okay, so thanks, Dr. Hamid. It was a very insightful sharing. So if you all can see my screen, I just want all of us to remember this one sentence, okay? When it comes to exercising, especially for muscle health and bone health. Just remember this: if you don't use it, you lose it. Okay, if you don't use it, you lose it. So same thing for both the muscle and the bone. So I just want to do a quick introduction. So how do bones and muscles interact? So bones actually give muscles a base to work from. Okay, all muscles attach somewhere to a bone. Okay, muscles give stability to bones where joints are, and that's why bones are important. Where you can, like your elbow, if your hands are just straight, you can't really do a lot of functional stuff, you can't feed yourself. Okay, and muscles move bones. Okay, muscles move bones. So the interaction between muscles and bones are very intimate, very intricate as well. So you cannot really, when we do exercise, you can't really say that, oh, I'm just working my muscle, I'm not working my bone. Okay, so bones, okay, so some things interesting about bones, like what Dr. Hamid has shared, bones are built to be loaded. You need to have some form of load through bones. Okay, the minute you offload the bones for a period of time, they tend to lose its density. So one very extreme case of such thing is astronauts. So astronauts in space where there's no gravity, it's been found that they do come back with a reduced bone density. Okay, so that being said, gravity is bone's best friend, but it's also the bone's worst enemy. Why? Is because if you don't have gravity, you probably won't fall down and you won't fracture yourself, right? But same thing, with gravity, your bones can get stronger, but that's also when you do fall down and you can fracture yourself because the impact is beyond what the bone can take. Okay, next, we talk about muscles. So for muscles get stronger as you use them. Okay, if you don't use them, you lose them, right? If you don't use them, you lose them. So muscles get stronger as you use them, and that's one of the reasons why we want to maintain a healthy and active lifestyle, so that even as we age and there's that degeneration and the loss of muscle mass, as we keep using it, we can actually slow down that rate of loss. Okay. Next thing about muscles, okay, I think once I say when you use, the more you use muscles, the stronger they get, then everyone will be thinking, oh, I'll just keep going to do my exercises and lift as heavy as I can. Muscles can complain when overworked. So we always talk about progressive strengthening. If you haven't been exercising at all, sedentary lifestyle, okay, don't jump into the gym, start lifting 10 kg weights, okay? Start slow. Start with even very, very low weights like 500 grams to a kg, okay? And the last thing is that muscles don't grow overnight. Muscles don't grow. A strengthening program that is effective, or to see the effects of a strengthening program, will take you at least 6 weeks of exercising 3 times a week, okay, for that muscle group. Okay, so don't expect to start some of these exercises and expect tomorrow your muscles will be strong. Okay, so today I'm just going to introduce exercises for 4 parts of the body, okay, that you can do at home. And all you need are things like either a resistant band, okay, or small bags of rice or beans, or even weights if you have at home. Okay, I'll be showing a lot of the exercising using resistant bands. So just some tips. If you see the different colors, okay, of resistant bands in, let's say, Decathlon or online Lazada, this is not for you to choose your favorite color and buy it, okay? Different colors have different tension, okay, and they equate to different weights that you are lifting. Okay, so if you can get a bag of like lightweight, medium weight, and heavy weight, then that's good enough for you to do your exercise regime. Okay, if you have questions, do ask like to see a trainer, a strength conditioning trainer, or even come down to a physio center in the hospital, in the polyclinics, or even a private center, and ask some questions on like how do we get one of these bands that fits your fitness level. Okay, so let's jump into the exercises. Okay, so the first exercise we will work, okay, is the shoulder with a forward flexion. Okay, I'm just going to play the video, and as the video moves, you can see. So using the band, you can lift it up all the way, okay, to where your ears are. Okay, so what you want to watch for is that you don't want the shoulder to be shrugging, like saying like, I don't know. Okay, if you are doing that, means the weight is probably too heavy. And you see from the side view, my back is not arching. So if it's arching, means it's too, it probably is too difficult for you, sorry. Okay, so if it is too difficult, what you can even do is just to bring it up to 90 degrees. Okay, just bring your shoulder up to 90 degrees, that's good enough. Okay, the next one that we are doing is shoulder abduction, means opening up your shoulder to the side. Okay, so if you notice in this video, I'm bending my elbows at 90 degrees, okay, for a start. So I'm bending it at 90 degrees. I'm not keeping my elbows straight out. Reason being, from experience and just knowing a bit of physics, if you keep your arm straight out, that the tension around the shoulder joint might be a bit too high, can cause some shoulder rotator cuff injury or deltoid injuries with that. So I usually get my clients starting with the elbows bent. Okay, same thing. If you can't bring it up all the way, just bring up to 90, that's good enough. Okay, so the next one that we're going to do for the shoulder, okay, is a shoulder squeeze. Okay, shoulder squeeze. And take a look at this. So just squeezing your shoulder back. Okay. So from the back view, what it will look like is just imagine you're putting a piece of paper right in between your shoulder blade and you're squeezing your shoulder blade together. Okay. And okay, the next one that we are doing, okay, don't worry about taking photos and all this. I think I'll share these slides with the videos with the organizers, and then y'all can see if we can push it out to y'all or put it on a public platform. Okay. This one is something, this is what we call shoulder press, okay, or push-up position. Okay, so let's just take a look at the video. So one thing you want to watch for when you're doing this, okay, is to watch for compensations with trunk wriggling, you know, like a worm. When you go down and then you come out with your trunk first and then your butt follows. We don't want you to do that. You can get back injuries while doing that. Okay, start with your upper body on a higher surface than your legs. You can even start on a countertop or even against the wall. Okay, that can load the muscles on your shoulder, okay, and your bones in that position. As you get stronger, then you go to a lower position, progressively advance to doing it on the floor if you are able to get down to the floor and get up from the floor easily. Okay, so of course, if you do want to make it even harder, is to put your legs up on the surface so that your leg is higher than your hand. Okay, but there's actually really no need to go to that extreme. Okay, just doing it with at most with your hands and your legs level on the floor, that will be good enough. Okay, the next one for the upper limb is your bicep curl. Okay, so it's like holding a weight, okay, and then just bending your elbow. Okay. And so from the side view, what you want to watch for is that you're not shrugging your shoulder again, okay, and not tilting your back backwards, not arching the lower back. Okay, can? Okay, next one is the triceps. This is the back of your elbow. Okay, this is how we strengthen it. Okay, so triceps straightening. So it's like just pushing your hand outwards with that resistance. Okay, just pushing, we see that again. Okay, pushing your hand outwards with resistance. Okay, can. So before I carry on, let me just switch back to see, is there any? Okay. Okay, so, okay, you can try using the orange band. Okay, it's hard for me to say because different brands have different color codes relating to their the tension. You can try it if you're using the band and it's causing pain with your exercise, or you are compensating like what I showed you just now. Some of the movements you're compensating, then probably it's too heavy, then it's too thick a band. You might want to get something that is lighter. Okay. I'm down with osteoarthritis on both knees, right, to say only certain exercises are required. Does massage help alleviate pain or worsen it? Okay, so osteoarthritis and osteoporosis, quite different things that we are talking about. So if you do have osteoarthritis in both knees, there are certain specific exercises that we prescribe to help strengthen the muscle. Massage, it really depends what kind of massage and why you're doing the massage. If the pain is due to a tight muscle and you are trying to release the muscle through massaging, it might relieve the pain, but yeah, I would say see a medical professional on that for that first. Okay. Okay, let me just jump back to the exercises. Okay, so shoulders. Wow, okay. Is it better to use resistant bands or free weights? Okay, so this is a good question. Resistant bands and free weights are actually the same thing because you don't have any guiding cables. So if you want to compare free weights versus, let's say, loading yourself in between machines where the cables are guiding you, free weights and resistant band needs more control into the joint and the muscle. It's of course better to use resistant bands because you can adjust how much tension it is without having to buy the whole range of 1 kg to 15 kg. If you have a big house and lots of money to spare, go ahead. But resistant band is really what we call a gym in the pocket. If you want less tension, you just hold it further. You want more tension, you just hold it nearer. Okay, Ken? Okay, let's jump back to the slides. Okay, I'm going to go next into the torso. So torso is your spine, okay, your trunk area. Okay, so this is a good exercise to do to strengthen up all the muscles in the back. Okay, so trunk rotation. So, okay, one thing you want to watch, okay, when you're doing this is to watch that your hip doesn't turn. Okay, it's really just the trunk that is turning. Also take note that your hand isn't doing the movement, but your hand is stuck right at the center of your chest. Okay, it's just the trunk doing the movement. You should feel the stretch or the activation of muscles in the back of in the back muscles, okay, when you're doing this. Okay, left trunk side flexion or trunk side flexion. Okay, so you just hold it on one side and reach down to the other. Okay, so in this picture, the muscle that I'm training is the side that I'm reaching down towards, okay, which is where my watch is, which is my left side. Okay, so I'll hold the weight on the opposite. So if you are using free weights, hold it on your right hand, reach down to your left, that's training your left side flexors. Okay. So one thing to watch while you're doing this is that you don't hide your hip, means your hip on the right side or the side where you're holding the weight doesn't go upwards, okay? Okay, so this one is good for core strengthening. So planks. So one thing you can do, oops, sorry. So one thing you want to watch for is that your shoulder, hip, and knees are aligned when you're doing it. So if you see I'm doing this plank on an elevated surface, this is an easier way to do it, to start with your arms on a higher surface. As you get stronger, okay, you can bring it lower. So of course, ending with your shoulder, hip, and your arms and your legs on the floor, okay? So a good timing to start with is 10 seconds on, 10 seconds off, and just do 5 reps for a day. Yeah, so this is good enough to get the muscles activating. Okay, next one is bridging. So bridging exercise, very safe. You can do it lying down. Doesn't matter even if you're on your bed, on your sofa, as long as you can push through, that's fine, okay? So what you want to push is you want to push through your heel. Okay, you want to push through your heel and lift your buttock up. Where you should be feeling the tension or the muscles working should be your thighs, your buttocks, and your core. You shouldn't be feeling anything in your lower back when you're doing this, okay? So push your weight through your heel, lift off your buttock, just to that angle is good enough, okay? Okay, the next one, okay, to train up your glutes, okay, is this thing called monster walks, okay? So tie a band around your thigh, above the knee, okay? Then open up as wide as you can, walking towards the side. Okay, same thing, and then you walk back. Okay, to make this exercise more difficult, you either get a thicker band, or instead of tying it around the top of the thigh, around top of the knee, you can actually tie the band lower. The lower it gets, the harder it becomes to do this exercise. Okay, so that's one way to make it harder. For those of us who maybe have some balance issue, a bit scary to tie your legs and walk like that, similarly, you can lie on your side on the bed, okay, tie it around the thigh, okay, and do a clam opening position, okay? Just imagine there's a pearl inside and you're opening the shell. Okay, so one thing to look out for when you're doing this, okay, so you want to make sure that your hip is not rolling backwards. So you see my hip is not rolling backwards. Okay, because when you start rolling it backwards, you're not really activating your glutes. Then you're just wasting your time doing this exercise. Okay, okay? Okay, So I'll run through these lower limb exercises before we answer more questions, okay? So this is a very simple exercise, sit to stand. You can, everyone would have the equipment to do it. Just watch for a few things, okay? Watch for the compensation using momentum. Okay, you don't want to swing yourself up and you don't want to plop yourself into the chair. It's a very controlled movement. Okay, safety, if you are doing it on a lightweight chair, like what I am doing, make sure the chair is blocked against the wall or the table or sofa. The last thing we want is when you stand up and the back of your thigh hits the chair and the chair shifts, and when you sit down, you don't sit directly on the chair, you might fall down. Okay, that might be the cause for a fracture. Okay, so you want to either do it on your sofa, on your bed, okay, or if it's a chair, then make sure the chair is blocked against a backing so that it won't shift. Okay, to make this more difficult, okay, some people say you can do single leg stand. You can, okay, but for various reasons, if you don't want to, you have like some knee pain in your single knee, one side of your knee, what you can do is to tie a band, okay, put it around like what you are seeing here and stand up, lifting the band, keeping your band at your tummy area. Okay, so this is kind of like a weighted squat, okay, like a weighted squat, and gives more tension through the knee, okay. Okay, the next one is training your calf muscles, so doing your tiptoes. Okay, so I like to do it holding on to something for support so that I'm not training both strengthening and balance at the same time. Okay, one thing you want to watch for is the ankle rolling out. You don't want your ankle to be doing this. Okay, we see this again. Don't let your ankle roll outwards. Okay, that is a halfway to sprain position. Okay, what you want to do is to keep your big toes, push your weight through your big toes. Don't let your ankle roll out. Okay, we see one more time. Okay, can? Okay, the next one is to train up your hamstrings or the back of your thigh. And this is usually neglected. Okay, so it's a hamstring curl in standing. So one thing to watch for is that when you bend your knee, you don't bring the hip forward. Means the front of my knee doesn't cross the opposite side. Okay, so if you take a look, so it's kicking my heel up towards my butt and then lowering it down. To make it more difficult, you can either tie your ankle weight around your ankle or tie the band to the front, and then you do that action of bending the knee. Okay. Okay, my last exercise, knee extension. Okay, so you can do this in sitting while watching TV, hold it out. Okay, and that your leg weight is good enough weight for the thigh muscle to work on. Okay, if you want more, okay, tie a band into a loop, step on it with the other leg, okay, and kick it straight up like this. Okay, this is equivalent to a leg extension machine exercise. Okay, Ken, so let me just end off my sharing with just saying that why it's important to strengthen up the muscles. Okay, and because the muscles do pull onto bones, and through that loading of that muscle on the body is smart enough to recognize there's a need for the bone to be of a certain density, okay, to maintain or to not fail under that stress. So we do want to put that bit of stress into your bone, to your joint, through your muscles to prevent osteoporosis and to prevent sarcopenia. Okay, so one other common FAQ or one other common question that people ask is that would swimming be helpful? Okay, so taking into mind that it's not just always having to load. When your muscles strengthen up, it also loads the bone. So swimming and cycling, strengthening the lower limb and the different muscles that you use, they do help contribute to that strengthening of your bone as well. Although we do recommend that you have weight-bearing exercises on top of these other exercises that you have for cycling and swimming. Okay, and so if you do have any questions regarding certain exercises you're not too sure about, or whether, oh, am I doing it correctly or right? Okay, do search me up on Heartland Rehab. Okay, drop me an email and I'll try to answer your questions. And if you do need to see therapy, seek help. Don't have to be me, it can be anyone. Okay, most all the physios in Singapore are well trained. Go to a polyclinic, get the GP. Most of the polyclinics now have physios services in there with dedicated physios there. So do get help if you need help. Okay. So I'm just going to stop my screen share and we'll go into a time of Q&A.
Okay, thank you very much, Gareth. I think having the videos and the pictures certainly help. And I think a lot of them are requesting for the slides, and thank you for making them available after the talk. Fantastic. So I'm going to just screen through. I've tried my best to address as much of the questions as possible on the chat group itself. For some of you who have asked really personal, made questions into your personal conditions, I've sent a direct message to you, so do check that. I'm going to ask you some questions, Gareth. Some things related to osteoporosis and exercises. First one is that, will morning walk of 30 minutes to 1 hour help osteoarthritis of both the knees from me? So osteoarthritis generally a wear and tear condition of your knee. Osteoarthritis basically means your cartilage in your knee has worn out, and many a times it may be early stages or in late stages where bone is rubbing on bone. So while exercise certainly helps preserve your knees, however, in very late stages, your condition itself may also prevent you from actually being able to walk 30 minutes to an hour because you may get symptoms on board. However, there are some static exercises and strengthening exercises you can do at the comfort of your home to try to reduce the symptoms of osteoarthritis. Walking is always good to get aerobic activity, but things like cycling, aqua jogging, aqua walking, where you go to a pool, chest level water, practice jogging or walking underwater, tend to be more knee friendly if walking causes you pain. But I'm going to ask Gareth to sort of just bring us quickly through some exercises which may be of benefit to those of you guys who may have knee osteoarthritis, which is by far the most common form of osteoarthritis in our community. Gareth?
Yeah, so if you look at the exercise slides that I prepared, things like sit to stand, okay, non-impact. Okay, so strengthening of the quads muscle is important. Strengthening of your hamstring muscle is important. Strengthening of your calf muscle is important. Okay, those are good to do. So things like the sit to stand, seated knee extension exercises, standing knee flexion exercises to and your tiptoes. So these are good to start with. Okay, and as your muscles strengthen up, you do notice that the pain can actually reduce, working in tandem with what the doctors do for anti-inflammation and pain control. Please don't see it as, or I either do physio or I see the doctor for medicine. We actually work very closely together. If you have pain, you can't move, you can't do exercise. That's where the doctors have that role of advising on pain control and how much, and the physios do communicate with doctors in terms of prescribing the intensity of the exercises. Yeah, so like Dr. Hamid said, if walking in the morning is causing pain, you can start off with either cycling, static cycling, or walking in the pool. Then as the pain gets lesser and you get stronger, you can try some morning walks around the park. Yeah.
Thanks, Gareth. Gyokha, I've noted your question. You've asked the question on backache after walking more than 10 steps. We're going to cover it soon. But before that, I just want to answer an earlier question, Gareth. I think you might have covered it in your talk, but just to reiterate on, how much time does one need to do this on a daily basis, and how many reps or how many times a day should they do these exercises?
Yeah, so you can start off with, say, about 10 times, do about 3 sets of the exercises. That would be good enough. Okay, that would be that's like a arbitrary number that we give, and we do tailor it accordingly. If you do 10 times, 2 sets, and you start to fatigue or feel pain, that might be too much for your current level. Then you can bring it down to, say, about 6 times, 3 sets. Yeah. In terms of walking wise, we usually stick to what HPB advisors of 150 minutes of moderate activity in a week. Yeah, that would be good enough as well. For walking 30 minutes a day for 5 days a week, that's good. Yeah.
Okay, now back to Gyokha's question. Why does she get lower back pain after walking too much, say more than 10,000 steps? So walking is actually a weight-bearing activity, right? It involves loading, and there are large joints in the body that bears your weight. It starts with the lower back actually. The lower back is the most what we call proximal, or the nearest joint, respect to the position of the joints, followed by your hips, your knees, and then your ankles. Right, so generally speaking, you're using all these muscles without realizing while you're walking. So if you do get backache after walking too much, it could be a sign that your muscles in the back have loaded beyond their capacity or their strength. Because obviously when your ankle muscles, your calf muscles, your thigh muscles, when they get overloaded, the next big muscle to take is the hip muscles, and then after that is your back muscles already. So that could be a particular reason why you have backache. Of course, there may be other conditions, that also give rise to backache. We're not sure because it's a general question, but I'm going to ask Gareth to chime in with how you can strengthen your back and his take on this question.
Yeah, I think walking that causes back pain, there's so many contributing factors. One could be your shoes. Are you using the right shoes? What kind of terrain you're walking? Are you doing a lot of down slopes and you're not ready for it? Do you walk with a very arched back, that kind of stuff? And like what Dr. Hamid said, the strength of your back muscles, or what you call your core muscles. Your spine is what I always see your spine as the foundation of a building. So everything has to go through your spine. If you walk, the load goes through your spine. If you lift something up, the load also goes through your spine. So that's like the exchange center. And if it's not strong enough, a lot of times when the muscles are not strong, it causes stress on the joints or the bones or the tendons where the muscles insert into, and that's when you can feel the discomfort. So what you can do is to tailor your walking. Maybe if you know that 10,000 steps always causes pain, do 8,000 steps. Don't walk into the pain. Then what you can also make sure that you do is you do your stretches. So stretch your glutes, okay? Stretch your lower back. So what we call the prayer stretch. Okay, and some rotation, gentle rotation, no excessive cracking of your back just for the sake of it. Okay, so some simple stretches for the glutes and the lower back might help with that achiness or that pain in the lower back when you walk more than 10,000 steps. Yeah.
In that same vein, Gareth, someone has asked about causes of lower calf cramps, I suppose, in the night after a long day's walk, and how they can prevent it. Probably a very common symptom for people who go on long walks or frequent running, and you don't do stretching actually.
Yep.
Yeah. So I'll let Gareth cover that in a bit more
detail.
detail.
Yeah, I mean, the discussions or the question is what causes cramps, right? Like some people say lack of salt, lack of some minerals, and maybe may not be. It's not been proven. There's no conclusion to what causes cramps. But one of the things we know that if you overuse a muscle, if the muscle is used beyond its capacity, it can go into a cramp position to protect itself. So if you are walking too much in the day, and when you rest and the muscle cramps up, try to tailor or adjust your walking intensity, but make sure you do your stretches after your walk and before you sleep. Try this too. And if the cramps still come on, you might want to do a checkup and see if there are any other systemic issues that's causing the cramps. Yeah.
Thanks, Gareth. Stephen, thanks. I think it's a comment more than a question. That climbing flights of stairs daily is a good form of exercise. Certainly, it definitely is a very good aerobic form of exercise, and it's a compound workout because you're using multiple muscles at the same time while climbing stairs. Caveat though is that if you do have some kneecap arthritis, you would find that it causes a lot of symptoms at the front of your knee. So it's not an activity I would recommend for everyone. But if you're in a clean slate of health and you find that it really improves your fitness, then by all means, go ahead and do that. Joyce is asking how to help hip osteoarthritis. Now, generally speaking, hip osteoarthritis is less common than knee osteoarthritis, but we do see, I would say, in about knee arthritis and hip arthritis, the ratio of patients that we see in our clinic is about 1:4. For every 4 patients with knee arthritis, we see 1 with hip arthritis. Generally speaking, the set of exercises that helps with knee arthritis does help hip arthritis as well. Gareth's just going to chime in a bit with that. However, with regards to running, interestingly, walking causes more hip symptoms than running does. That is because of the load that goes through the hip when you walk versus when you run, because the amount of time you put weight through your hip is shorter when you do slow jogging compared to walking. So a lot of my hip patients, they prefer to do light jogging rather than going on walking. So that may be an activity modification that you might want to take if you find that you actually have hip pain while walking. You may want to do very light jogging, and that might actually cause you less pain if you want to do exercises that manner. But in terms of exercises to reduce symptoms, if you already have hip osteoarthritis, Gareth is going to answer that question.
Yeah, so you want to strengthen same thing. So the whole idea of this knee osteoarthritis and hip osteoarthritis is every one of us go through that process, right? And a lot of times it's because our muscles are not strong enough to match the load that you are putting the body through. And then that's when the pain flares up. And it's not fair to say that everyone who ages will get osteoarthritis, right, Dr. Hamid? Yep. Now you'll be seeing all the 80, 90-year-old people not walking anymore. But we do see people who are 80, 90-year-old still doing their marathons, doing their 1-hour walks, probably fitter than many of us young people who don't get exercise in like every day or 3 times a week. So the idea is that we don't want to strengthen the muscle around the hip, which is your glutes muscle. Okay, so things like the bridging exercise that is in the video, the clamps exercises that's in the video. Of course, we do have some rotation exercise for the hip that we would sometimes teach as well. But generally, just do your hip strengthening, like your squat, sit to stand, clamps, and bridging. Yeah.
Okay, someone is asking us a quiz question here. It's a trivia question, Lei Fong. Running will hurt the knees. It's better to walk instead. True or false? Okay, interesting question. So, right. Okay, so it is true that running strengthens the knees. There's no doubt about it. We have seen in studies involving runners that it does have a prevention towards osteoarthritis. So if your knee is in a pristine condition, you haven't had any arthritis, then a certain degree of moderate running is going to prevent you from getting it, because it basically improves the muscles around the knee, offloads the cartilage itself. However, if you already have arthritis in the knee, you are actually caught in this vicious cycle of cartilage damage. So the more weight you put through the knee, the more inflammation you induce in the knee. And what the inflammation does is it promotes more cartilage wear and tear, and therefore you're going to go on this vicious cycle with more pain, swelling, and you're not going to get better, obviously. So it really depends on what condition your knee is in. For most of my patients who have some degree of arthritis, they want to be active still. I teach them certain ways of still maintaining the activity, which is to cut down the intensity and perhaps drop the pace of the running, and do it stretch it out over the course of the week rather than long, intense runs for them. So it is really hard to say whether it's true or false, depending on the context. Gareth, anything further to add?
Yeah, I agree. If you're talking about someone who has been running marathons since they are like 30 and they're doing a marathon every month or every 2 months, and now that they are 70 and they're still doing marathons, will running hurt that person's knee? I would say likely not, because it's been an activity that has gone through. The body has adapted. The muscles know when to fire off, when to support the knee. The bones are familiar with that kind of loading. And in that case, it doesn't. But if you are someone who hasn't been, and then there's circuit breaker, and then suddenly everyone becomes a runner, put on your shoes and they start running, and then that's where all the knee injury starts to occur, because you haven't been running. And you remember, like 20 years ago, you used to do your 2.4 in less than 7 minutes. And then you are 20 years later and you think that, okay, maybe I still can do it at 7 minutes, and you run at that pace, at that intensity. And then that's when you get injury. And then you think that running causes the injury. But no, it's just overloading. You're doing it too fast, too soon, too quick, too much. Yeah. So I would say that it's very conditional whether that even lifting weights can cause injury if you don't do it correctly. So it's not fair to say that a specific activity in itself will cause an injury. Yeah.
Great point. And yes, we had to bring up that 7 minutes 2.4. Okay, one last question before we wrap it up. Why in aircon frequent cramps? So this is a very interesting question. You know, in life, a lot of things we do are not very apparent, right? So it may not actually be the aircon that causes the cramps, but actually what are you doing in the air-conditioned environment or the room that may be actually the answer to your question. If you're sitting down for a long period of time in an air-conditioned room, it may not actually be the air conditioning that causes your cramps, but the fact that you're sitting in a same posture for 2-3 hours on your computer, that may be the problem. Scientifically, there's no evidence to show that air conditioning causes any muscle issues per se, because people in temperate countries, you know, they are in constant air condition all their lives. They don't complain of cramps. So it's really the activity that you do in the air conditioning that would be important to find out. Having said that, sometimes loss of heat from muscle, excessive loss of heat from muscle may cause the muscle to shorten, right? That is why we stretch our muscles, and sometimes applying deep heat and rubs to the muscle actually alleviate symptoms. So that could be a potential reason for that. But pay attention to what you actually do in the air-conditioned room. So if you're sitting down for long periods of time, as Gareth very beautifully said previously, you know, the best posture is your next posture. So frequently, did I get it right, Gareth? I better let you take that thing on posture before I misquote you.
Yes. Yeah.
Yeah, do you want to just add something more about
right.
postures, when, especially in these days from work from home, they're going to be sitting down for long periods of time in a fixed posture. Yeah. So maybe some tips for them.
Yeah, it's really about movement. So don't stay in a fixed position for too long, because any position you are in, it does cause stress to your joints, except maybe when you're lying down. Okay, that's like zero load through the joints. But yeah, it's about slouching sometimes, and then sitting tall, and then standing up, and then going off to turning to your left, turning to your right, just to get the muscles moving and the joints with the circulation of the blood through properly in that sense. Yeah.
Okay, it's 5:42. We have 12, a good 12 minutes past the time. I thank every one of you for coming here today, contributing actively, asking questions. It gave me and Gareth a great opportunities to clarify, and I hope this was useful. We do plan to have these sessions on a more regular basis. We want to dive down more deeply into how nutrition can contribute to better health, together with exercise, and we'll talk about many other musculoskeletal issues together with myself, Gareth, and I'll try to bring in as much expertise as possible to the room to answer everyone's question. I see some last minute questions. We can't take them today, but we'll definitely get back to you. This is recorded, and Chun Seong is going to take down these questions. And if you're in Taman Jurong, we would know a way to get to you, and I will definitely be answering those questions that haven't been answered. So with that, I thank all of you.